Thank you very much, Premier. So in terms of the 4 cases I wanted to discuss today, I'll take you back to the diagnosed case we announced yesterday, and we issued 3 public health alerts with venues. So I urge people to check that website for those updated venues. So we had a gentleman in his 60s who is a driver who drives a limousine, and he is, as part of his work, is involved in the transport of international flight crew. He tested positive on salivary testing, and then that was reconfirmed on the oropharyngeal swab and tested positive yesterday. His household contact, his wife, has tested positive yesterday, and that was what also led to some additional venues being identified. Last night, pathology confirmed that this gentleman has the Delta strain of the virus, and that this strain does not match anything that's been uploaded in Australia at this time, but it does match perfectly a sequence that's been uploaded from the US. And so that fits with that plausible hypothesis. Whilst we do test flight crew on the way in, there's always a chance, as I indicated to you, that that's why one test at one point in time does not confirm your infectiousness, and you may develop infection at any point during your period before you're departing Australia. So that's our working hypothesis. Whilst infectious, the couple attended a number of venues in Vaucluse, Bondi Junction, Zetland, Redfern and North Sydney, including the 200 bus from Bondi Junction to Northern Sydney and return on June 15th. We've tested 4 family close contacts who are from a different household who spent time in the infectious period with that couple, and 2 workplace close contacts have also tested negative, but they'll be in quarantine for the full 14 days as their close contacts. In terms of the new cases that we haven't identified, last night we had a person who was diagnosed who tested yesterday morning, so before this news broke out. So again, it highlights my gratitude. I want to extend my gratitude to the residents of New South Wales for coming out for testing. That person had attended the Bell Cafe at Vaucluse at the same time as the driver on June 13. We consider all people who were at that Bell Cafe at the same time as the driver to be close contacts, and they must all be tested and isolate for 14 days after their visit. Now, because we have had transmission at that cafe, we are urging everyone to take the request for testing seriously. Please present now. That will help us identify any unrecognised cases and stop any further chains of transmission. In terms of the additional gentlemen, we've had a gentleman in his 40s from Sydney's northwestern suburbs who is not, on preliminary interviews, not linked to any of the sites or venues. The gentleman had high CT values, and for us that means a low viral load. We do the usual things. So when you get that, you're uncertain about the timing of infection. So what we do is we repeat the testing the next day. Sometimes it can be early in an infection when you get that high CT value, low viral load. High CT values can indicate that you might be beginning to be infectious, or it could be an old infection or in false positive. So we're testing all of his household, doing other respiratory testing on the household, and also reconfirming that testing. And if there is any virus to be sequenced, we will obviously sequence it urgently to see that it's linked to this cluster. It's always important that we keep a very open mind in these investigations at this time. So for me, the message is we've identified a number of venues. When you were contacted, and can I thank the community last night for the response, we had about 450 people ring the call line last night to self-declare that they were at contact venues. So thank you very much for the community response. We know that there's been a strong response to testing, and those test results will actually allow us to assess the extent of the risk posed by this incursion event. As the Premier said, this is a time for us to be vigilant, so pay particular attention. Please follow the health advice, but check regularly that website, because as we interview cases, people do remember new things. As you know, we often interview cases several times, and those lists will change. We also go through a process where we've issued a stop and stay, And what that means is we're asking people for a number of venues just to get tested, isolate, and then public health will evaluate the situation, and sometimes that information changes. If we find that transmission has occurred in an event, that might allow us to increase the scope or upgrade our response. So again, please, every day, could I urge everyone to check the New South Wales Health website for those venues of concern. Thank you.